I'm Cindy Hewitt. I'm the Director of Services at Community Crisis Services and Food Bank in Iowa City. We offer non-judgmental support to folks in the Iowa City and surrounding areas for crisis, any kind of crisis or basic needs that they might be having difficulty meeting. On our website, we have really easy tabs with drop downs. You can see all of the different services we have. Also, it will give you the different ways to access. We do accept walk-ins to our food bank in Iowa City. We accept walk-ins at our main location at 1121 South Gilbert Court, that's in Iowa City. And we also have a variety of phone numbers to access our crisis intervention services, the National Suicide Prevention Lifeline, chat and text help for crisis. We also have a mobile crisis outreach program that has a specific number to dial, so those teams can be dispatched that way. Again, I think the easiest way to find all that information would be to go to the website. You can also call our main number, 319-351-2726. And in the messaging in that answering machine, there'll be all the directions of how to access the different types of services. You can call 24/7. We do have programs like Mobile Crisis Outreach and the Crisis Intervention programs that operate 24/7. Those, again, are intended to provide de-escalation support for persons in mental health crisis. As most nonprofit organizations, we depend on a lot of funding from private donors. Our food bank receives some great donations from community members and other local organizations that provide what we call in-kind donations, so actual products that we can pass along to our clients. We also get funding from grants and contracts, federal, state, and local government levels. Those are typically things that we can apply for as far as grant funding, contracts that we will enter into with another entity. And so that will provide funding for the services that we offer. We, of course, always accept monetary donations. Those are typically, again, from private funders. And unfortunately, during COVID, we weren't able to have the hunger banquet as we usually do. Typically, it's a big in-person event. It basically allows you the experience to see what it's like when you have plenty of money to buy food and when you don't have enough money to buy food. And you have no idea what you're going to be getting when you go to this banquet. And so all of the funds from that are, of course, fundraisers for community. So we, for instance, right now we're also having what we call TP Community. So we're taking toilet paper donations throughout the month of October. We do also get donations from other organizations. The Boy Scouts just had their food drive and donated over 22,000 pounds of food to us this past weekend. Regina School District also donated about 1,200 pounds of food to us on Monday this week. So those are amazing efforts that community members also make to provide food and other items to our organization. You know, the food bank that we have offers what we call a client shopping experience. So clients can literally take a cart around and pull things off of the shelf like they would at the grocery store. That way they're getting items that they prefer to get. There's not as much food waste. We offer different healthy items, staple items, of course. So with that and with the pandemic and not being able to have many people in a small space, we ended up moving our location to Pepperwood Plaza in Iowa City. And that is really a big warehouse. We ended up creating that space to work for as a food bank. It's really been a wonderful move for us. As a matter of fact, we're planning on staying there for at least a few more years. That again allowed us to maintain that social distancing and continue to provide that shopping experience. So that was one of the biggest changes. Another effect that we noticed was a lot of our crisis intervention programs, we must have adequate training for our staff. You know, it's very important that they receive the crisis intervention training, suicide intervention training, and the assist training, which is really kind of the gold standard in suicide intervention training, is expected to be an in-person training, needs to be an in-person training. So throughout the pandemic, when things were really shut down, we weren't able to provide that in-person experience or that in-person training. So one of the things we had to do, and thank goodness we had some really talented staff to do it, was to create an online version to the best of our abilities that would provide suicide intervention training, crisis intervention training, and some of those skills that go along with that. So that can be a massive effort, and it took a little while, but we were able to do that. So at least we had some of those essential trainings available to staff. So another area that was really affected was our mobile crisis outreach program. That's a program where we go and meet clients in person wherever they are, whether it's at their home, at the schools, in a park. So that had to change. We had to back off of that in-person response. And we did a lot of telehealth, which was great. And we were so thankful to have the opportunity to use telemedicine or telehealth. So those were some of the major changes. We did lose a lot of volunteers. CommUnity is a very volunteer-driven organization. It always has been. And we probably lost over, I think it was about 65% of our volunteers during the initial COVID time. And, it was difficult to get people to come back after COVID, of course, and trying to make sure that we were doing everything we possibly could do to maintain a safe and comfortable environment for our volunteers and our staff. So that was really difficult. It was stressful for the staff. Again, we still wanted to provide services to the best of our ability. And when it's short-staffed like that, the lack of volunteers was really felt. One of the things that we did see a great need in was our housing and utility assistance program. We do offer some rental assistance and also a security deposit program. That really increased, especially I would say in the last 6 months. Once some of those eviction moratoriums ended and things like that, that's when we really started to see some folks having trouble in that, that area of their lives. We collaborate with many different agencies around. Table to Table is a great organization that we've had a really wonderful and successful collaboration with for our food bank. We also collaborate with HACAP, which is a government organization that provides much of our food to us. For crisis intervention, we're currently collaborating with the Iowa Department of Public Health and the Department of Human Services to assess how our state will implement the new 988 program. If you're not familiar with that program, it's a 3-digit number, 988, that will function essentially like 911. So instead of someone having to contact a 1-800, multiple digit number to access the National Suicide Prevention Lifeline, for instance, they'll be able to dial 988. And that will get them that access. So it will be simpler to remember, especially when you're in crisis and maybe your thoughts are not perfect at that moment. We also have a wonderful collaboration with the new Mental Health Access Center in Iowa City called GuideLink. That's a collaboration with Abbey Health Center, Penn Center, the Johnson County Ambulance Service is a big piece of that. Prelude is another organization that's involved in that. That's been a collaboration, ongoing for many, many years now, and it's now in place and going full force. And we're really excited about that. It's something that the community needs, and we're all very passionate about having that service in the Iowa City area. So one of our newest collaborations also is with the Iowa City Community School District. Our mobile crisis program has always responded to the Iowa City schools if they had students that were experiencing some suicidal thoughts. What we're hoping to do now is kind of expand that relationship to allow us to go in and help with students who are in crisis, and we can go and help again with more de-escalation, not only suicidal risk assessment. So really hoping to be able to support students and staff at the schools when students are in crisis also. So that's another collaborative effort that we're working on now. We at CommUnity are really passionate about mental health and meeting people's basic needs. We would love to create a culture in our immediate community of acceptance, understanding of mental health concerns, One of our largest programs would be the Mobile Crisis Outreach Program. And the biggest piece of that program would be jail and hospital diversion. We don't want clients to have to spend time at the hospital if they don't need to. We certainly don't want clients to be arrested or put in jail if they don't need to be. So we feel very strongly about that, and we'll continue efforts to make sure that we're participating and offering services that will continue to divert clients from those places.